Hello, this is Dr. Grande. Today's question is, what is psychopathy? If you find this video to be interesting or helpful, please like it and subscribe to my channel. That way you won't miss anything new. Now, when we talk about psychopathy, a lot of times we think of the diagnosis that we see in the Diagnostic and Statistical Manual, antisocial personality disorder. Now, these two constructs, psychopathy and antisocial personality disorder, are similar, and some would argue they're really the same thing, but I usually think of them as distinct, and I think the research supports this perspective fairly well. So we could think of psychopathy as having all the characteristics we would expect to see with antisocial personality disorder, plus characteristics from other domains, specifically interpersonal and affective domains. So in order to describe psychopathy, I'm going to compare it a bit to antisocial personality disorder. I'm also going to review the Psychopathy Checklist Revised as another way of kind of explaining the differences we see with psychopathy. And I'm going to use the 5-factor model. I'm going to describe the personality profile from the 5-factor model that we see associated with psychopathy. So with these three different angles that I'm looking at with psychopathy, I hope this subject matter becomes more clear. So I'll start with antisocial personality disorder. Now, to understand antisocial personality disorder, of course, we look in the DSM. We see that there are 7 symptom criteria and then 3 other criteria. So of the 7 symptom criteria, 3 would have to be met. So here we see violating social norms, lying, impulsivity, irritability and aggression, disregarding others' safety, irresponsibility, and lack of remorse. Those are the 7 symptom criteria, and they would have to be present since the age of 15. Then we have the other criteria I mentioned. An individual has to be 18 years or older. Evidence of conduct disorder would have had to have been present before the age of 15, and the symptoms of antisocial personality disorder can't occur exclusively during the course of schizophrenia or bipolar disorder. So we can see from this definition of antisocial personality disorder, it would be hard to conceptualize a presentation of psychopathy that didn't also qualify as antisocial personality disorder. And in fact, this is how we usually think of it. We think of psychopathy as a subset of antisocial personality disorder, so that almost all of individuals who had psychopathy would qualify for antisocial personality disorder, and a number of individuals with antisocial personality disorder would qualify for psychopathy, but not all of them. A number of the studies on antisocial personality disorder and psychopathy look at male criminal offenders in the prison population, and here we see that around 70 to 80% of those individuals qualify for a diagnosis of antisocial personality disorder, but only about 15 to 25% could be classified as having psychopathy. So with this idea that almost all individuals with psychopathy would qualify for antisocial personality disorder, where would the possible exceptions be? Are there any presentations of psychopathy that would not align with antisocial personality disorder? Well, when looking at the 7 symptom criteria for antisocial personality disorder, it's difficult to imagine an instance of psychopathy that would not at least meet 3 of those 7 symptom criteria. I suppose it's possible. Usually where we see the exceptions would be around the other criteria with antisocial personality disorder. For example, with psychopathy, there's no rule about being 18 years or older. Symptoms of conduct disorder would not have to have been present before the age of 15. And there's no rule specifically about schizophrenia or bipolar disorder. Even still, with these possible exceptions and the possible exceptions we could see around the symptom criteria, we usually don't think there would be many exceptions at all. So mostly everybody who would be classified as having psychopathy would also qualify for antisocial personality disorder. So what are these extra characteristics that we would see with psychopathy that we wouldn't necessarily see with antisocial personality disorder? Well, to answer this question, I'm going to take a look at this second way of describing psychopathy, and that's to review some of the features of a very popular instrument used to measure psychopathy, the Psychopathy Checklist Revised. Now, this instrument is a psychometric instrument, and it has 4 facets. Facet 1 is interpersonal, facet 2, affective, facet 3 is lifestyle, and facet 4, antisocial. So if we look at facet 1, that's interpersonal, we see certain characteristics here that we would normally associate with psychopathy, including superficial charm, pathological lying, grandiosity, and being manipulative. So if we look at just this interpersonal facet from the PCL-R, we see that really only the pathological lying has overlap with the definition of antisocial personality disorder in the DSM. Now looking at facet 2, affective, we see characteristics like callousness, lack of remorse, shallow affect, and failure to accept responsibility. So here, of course, we see lack of remorse lines up with one of the symptom criterion in the definition for antisocial personality disorder. Now with factor 3, this is lifestyle, and here we see irresponsibility, impulsivity, a need for stimulation, a lack of realistic goals, and what's referred to as a parasitic lifestyle. So here we see overlap with antisocial personality disorder in the area of irresponsibility and impulsivity. Facet 4 is antisocial, so here we see characteristics like early behavioral problems, poor behavioral control, and juvenile delinquency. So this facet lines up fairly well with the definition of antisocial personality disorder. Now the last perspective I'll use here to describe psychopathy is the 5-factor model of personality. And we remember these big 5 traits through the acronym OCEAN: openness to experience, conscientiousness, extroversion, agreeableness, and neuroticism. So each of these 5 traits also contains 6 facets, and it's at the facet level that we can really understand someone's personality. So everyone has personality characteristics. The 5-factor model is just one way of measuring those characteristics. And we see a particular 5-factor model profile that aligns fairly well with psychopathy. But that doesn't mean that everybody who has psychopathy would have that profile, and it doesn't mean that everybody with that profile would have psychopathy. So I'll start here with openness to experience. Interestingly, openness to experience really doesn't seem to have a relationship with psychopathy, and it's the only trait in the 5-factor model that doesn't. So next we move to conscientiousness. Now this one does have a particularly strong relationship with psychopathy. Now again, each of the traits would have 6 facets. All the 6 facets of conscientiousness tend to be lower in individuals who have psychopathy. So the 6 facets of conscientiousness are competence, order, dutifulness, achievement striving, self-discipline, and deliberation. So again, all those scores would tend to be lower. Now with extroversion, we only see 2 facets related to psychopathy: warmth and assertiveness. We see lower scores of warmth associated with psychopathy and higher levels of assertiveness. Now with agreeableness, we have kind of the same situation we saw with conscientiousness. All the facets are involved, and all of them tend to have lower scores. So lower levels of trust, straightforwardness, altruism, compliance, modesty, and a facet referred to as tender-mindedness. So that brings us to the last trait, neuroticism. And here again, just like with extroversion, only 2 of the facets are involved. We see differences with anxiety and anger. Lower levels of anxiety and higher levels of anger are associated with psychopathy.
What do you guys think? Do you have anything to add on top of this conversation? Please leave your comment below. We would love to hear from you.
Thank you for making it this far. If you like this video, you might want to share it with a like-minded friend. Thank you, and as always, stay blessed.